Hi, my name is Emily Sedgwick. I'm section head of breast imaging at Baylor College of Medicine in Houston, Texas. And today I'm going to talk to you about patient-centered care. I think the easiest way to think about this concept is if you put yourself in the shoes of the patient. So pretend you're a 46-year-old mother of two and you notice that you have a new breast lump when you take a shower in the morning. The first thing that you do is you call your primary care physician and you set up an appointment. And then you see your primary care doc, and your primary care doc wants to send you for a mammogram. What we've done in our program is to make it as easy as possible to resolve the patient's problem. We've looked at every obstacle and addressed every obstacle along the process to minimize the fear, time, anxiety, and cost that may be associated with a breast problem. So your 46-year-old mother goes to her primary care physician with the lump. The primary care physician writes an order for a mammogram. We've created a process where the primary care physician creates a referral, essentially allowing the radiologist to perform the mammogram, the ultrasound, and even the biopsy all on the same day. So the patient's issues are addressed and resolved within one day. In addition to that, we looked at the billing process, where we wanted to ensure that patients were not surprised or dissatisfied with the bill. And in our program, we worked in a multidisciplinary manner to make sure that the patient had an understanding of what her financial obligation was before she committed to having the procedures or the additional imaging. The next step was to create a welcoming environment. We spent time in who we hired and how we hired. And also, I recognized the importance of a multidisciplinary team when we took care of the patient. So from the person at the front desk, we ensured that she knew who the patient was. We did not make them wait in the front waiting room. We immediately brought them back into the dressing area, where they were addressed by a mammography technologist who had years of experience, who had standardized protocols, which minimized the amount of time that the patient was brought in and out of the mammography room. Those repeated images, each time the patient goes in and out of the mammography room, just contributes to the patient's anxiety and fear and concern that there may be a problem. And by standardizing our protocols, we were able to minimize that fear. In addition, we cross-trained our mammography technologists to become ultrasound technologists. So they would have the same mammography technologist and ultrasound technologist for continuity of care, and also for an established relationship to make the patient feel more comfortable. Finally, our team of breast imaging experts comes in and communicates with every patient, whether it's a screening mammogram or a diagnostic mammogram and an ultrasound. And when we communicate with the patient, we have the patient sit up and put her jacket on, and we sit down. And the reason that we do that is because studies have shown that patients feel a stronger relationship with their physician if they're sitting up, looking eye to eye to the patient, and if they're not undressed. Patients who are undressed have a harder time remembering what the doctor says. And also, if the physician sits down, it creates a more equal relationship where the patient feels more comfortable. We also have a very low threshold for bringing in the patient's family members. And we did this actually because of my own personal experience. My 35-year-old brother had a heart attack, and I remember being in the room when the team came in to talk to him about the next steps. And I thought they did a great job using layman language. But then after they left, my family turned to me and said, "What did they say?" And I realized how many times that my patients may have felt that when I told them that they needed a breast biopsy. And so now we routinely bring the family members into the room and communicate with them so they have a second set of ears to hear what we're talking about. Finally, we also choose our words carefully when we speak with the patient. In fact, with my breast imaging fellows, I sit down with them and we role play and say, okay, what are you going to say to this lady who probably has breast cancer? And they will pretend like I'm the patient, so then we can practice. So we're very careful about our word choice, that we give hope at the time of communicating with the patient, and we also give them a defined plan. Finally, after we get the biopsy results back, the radiologist calls the patient with the results. We are able to turn a process that can take up to 6 weeks from beginning to end at another facility down to a 24-hour process where we do the same day workup and biopsy, and then we give the results within 24 hours. We started this in a private facility, and after about 3 years of success and very high patient satisfaction, I was given the opportunity to take this patient-centered program to a much higher level, to our county hospital program. We live in Harris County, which is the third most populous county in the United States. There are 2 million women in Harris County, and 40% of those are greater than 39 years of age. So there's a huge patient population that needed care. At the time that we came over to Harris Health Facilities, it was 89 days from abnormal imaging to biopsy. So a woman who had a normal screening mammogram had to wait 3 months before getting a biopsy. And it was 121 days from abnormal screening mammogram to her first day of treatment, whether it was chemotherapy or surgery. Within 18 months, with a patient-centered program, we were able to offer same-day workup and biopsy to the women at Harris County, just like their insured sisters were receiving at Baylor Clinic. Patient-centered care is not only a humane and ethical way to treat patients, but it also makes economic sense. And by employing the standardized patient-centered approach at Harris Health, we were able to realize an additional 3,900 mammogram slots per year. Think about it. An additional 3,900 women were able to get mammography that were not able to get it with this new patient-centered approach. So patient-centered medical care is not only the right thing to do, it's the way of the future and something that should be embraced by all.